Hello friends, this is DrRBKushwaha, professor in the division of DCC, Scotch Jammu, RS Program. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe to the channel and hit the bell icon for further notification. So today we have a case of the left tibial fracture in a stray bull calf. So you could see here, so there is a swelling. So when we took the radiograph, so we come to know that there is a distal 1/3 long oblique fracture of the tibia. So now we prepare this animal for the internal fixation of this particular fracture, because there is a wound at the here in the fetlock region, so that's why we can't apply any external coaptation. Certain landmarks for the tibial approach you could see. So this is the stifle joint, this one is the patella, here is this proximal extremity of the tibia. So you could see here there is a anterior tibial tuberosity, this one is the medial tuberosity, and here is the tibial plateau. This is the depression from where we insert this implant, and this one is the hock. So although the shaving is not appropriate, but we have thoroughly scrubbed so many times so that even no dust dirt in the hair. So even this hair, if it is looking odd, but it is properly washed and scrubbed with the antiseptic solution several times. So you could see here there is a soft swelling, that means here it is accumulation of the seroma. So we give the incision here at the medial aspect. So we give the directly incision over here. So we give enough long incision. Now you could see. So this is the probably a 10 days old case, and this calf is enough lucky that doesn't has this compound fracture. Otherwise, in most of the time, the tibial fracture converted into the secondary compound fracture. So this is the only 50 to 60 kg body weight this calf. So that's why I have chosen here for the internal fixation. Otherwise, in a adult one, most of the surgeon they avoid the such type of surgery. They go for the either the hanging pin cast, or if the compound fracture, and moreover in the mostly in the adult animal, the tibial fracture become the compound. Sometimes it is the primary compound fracture, but most of the time it is the secondary compound fracture. So this one is the proximal fracture fragment, you could see here, and this one is the distal fracture fragment, which is very long, sharp, and this long edge here. So here the soft tissue has entered in the medullary cavity also. So this one is the self-centering. So this animal is bellowing just because of the effect of the xylazine. First we make a nick here, small nick here. So the shape of the tibia is like that in the proximal extremity, it is triangular in shape, and as you goes down, so definitely there is a narrowing. We have to insert only here. So this pin, because the animal body weight is only 60, maximum up to 60 kg. So now you could see this one. Now this pin has emerged at this fracture side, you could see here. So now next step is we reduce the fracture fragment and then we insert this part into the distal segment. This is the long oblique fracture, and after intramedullary pinning we have to put the wire also, as in case of the dog. So now next step is we will apply the force in opposite direction. So by doing this, so there will be a exhaustion of the muscles. So muscles become fatigued after some time and the reduction become definitely easier. So here the intramedullary pinning we are doing exactly in the same manner as we used to do in the case of the canine. So nothing special, but the case is different. So as far as anesthesia of this particular animal is concerned, so we have given the 0.1 ml xylazine and 0.9 ml ketamine. So we mix the both drugs and make it 1 ml and inject it intramuscularly. And for the analgesia of this particular region, hind limb, we have given the 5 ml lumbocephalospinal analgesia. So we have given the 2% lignocaine anesthetic solution. So now I will try to hold this both together like this, and the moment rotate like this. Okay, like this. Okay, yes, huh? So this is the actual. So let me one more. Yes, now just wait. So this is the most important part of the fracture management, this reduction, and we should never lose our patience while doing this surgery, particularly the reduction part. So if you see here, so alignment is looking good, but still there is a slight overriding because this fracture fragment is very long. So either I cut the few or let the little bit overriding as such. So this one is yes, like this, okay. Yes. So now this is the better reduction. Although because of the sharp oblique fracture fragment, let me introduce this pin. Then here we pass the same pin slowly. This is the 225 mm or 22.5 centimeter long, this pin. So I think it will go whole. This is still going. Okay. So now you can see here. So this fracture fragment, you can say there is a fixation, but this fixation is little bit, you can say exactly it is not in the, because there is a slight rotation here like this, but it hardly matter. So we have to put one wire, if keep like this. Yes, like this. So we put one wire here. This one is the wire passer on. Remove it. दावनी में जाए इतना पे नहीं ठीक, इसको निकाल निकाल। ऐसे करो, छोड़ दो। So one switch, we have to check here. So this one is the 19 gauge orthopedic wire. Now we will cut from here. So in this way we fix this both fracture fragments together here. So now we release this one. So we see the alignment once again here. So there is no rotational movement, there is no. So and moreover, if you fix here, so if you move here, so it is moving along with the. So it is nice. Next step, we will close this one. Wash thoroughly, yes. With the gauze piece, someone please. Put the betadine here. Put the betadine. This fracture fragment is slightly rotated. This one is not. The edges are exactly in a position because of the rotational, and this fracture fragment is very oblique. So either we have to cut here. So I deliberately leave this one so that it will overlap over each other and it will fix tightly. So although this is the large animal, but this size is very small. This is the probably the 3 to 4 month old. But this is the stray animal. Stray means they rescue this animal from the roadside. In case of the animal, large animal, in case of the ruminants, instead of going with this one massage individually with the, although it is not infected, but still I prefer to apply this figure of 8 suture pattern with the nylon. So this one, okay, remove this one from here. So this is the switched on nylon suture here. So we prepare this one with the hypodermic needle. So now we are going to repair this surgical site in the figure of 8. Now you could see how we apply this one. So you see carefully how we apply this figure of 8. Please someone put the light here. Yes. So this figure of 8 suture pattern is very useful suture pattern, particularly where you see there is an infection. But here, although in this case there is no infection, but since this is the ruminants and the care is not normally is being taken as in case of the dog, so that's why I here prefer to apply this figure of 8 with the monofilament, this nylon suture. So now this is the first bite, and second bite we take from the subcutaneous region including the muscles from the opposite side, and then from the within the outside, but only in the subcutaneous or in this muscles, and then the opposite side is skin. So it is basically, it makes a two loop in between the skin and the muscle. So it is basically a figure of 8 suture pattern in vertical direction. Because in the animal, once if there is an infection somehow to the vicryl or polyglycine, polyglycolic acid, so once there will be infection, so what happens? The thread will act as a source of infection, and the infection will remain inside till you remove those sutures. So this is the reason why here I am applying this figure of 8 suture pattern. So there is a little bit difficulty here because this needle is. Keep the forceps, yeah. we'll apply the suture here also in the figure of 8 pattern as we applied in this case, and after that then we'll apply here the bandage. So now you could see here, so we have repaired this incision site with this nylon suture material in a figure of 8 pattern, and in between we applied the simple interpreted suture. So this is all about this intramedullary pinning using the centrally threaded intramedullary pin in a history calf. So thank you very much for watching this video, and if you like this video, so kindly share with your friends and hit the bell icon for further notification, and if you have not subscribed, so kindly also subscribe the channel for the further notification. And one more things, if you want to become the member of my channel, and if you want to see those videos which are actually for the members only, so you can also join this channel for the membership. So thank you very much.